All right, 12:05 everyone. Thanks so much for joining us. You're in for a treat. Elisabeth will be talking about holistic caring at large and introducing all the professional training and self-paced patient programs and everything about coaching the world to wellness.
Okay, well, thank you for the introduction, Alp, and for always being my beautiful MC. I appreciate everything that you and Brian and my whole holistic caring team do to support this mission. So my name is Elisabeth Mack, in case anybody doesn't know me. And today we're going to be talking about the holistic caring programs and what it's like to coach the world to wellness and why we're doing what we're doing. So always a quick disclaimer, this material is educational in nature, not to be intended as medical advice. And, you know, all of the things that we do are copyrighted, so please contact us for any licensing issues. I always like to start with my story. How did I get into this? You know, how does anybody become a cannabis nurse, etc.? So, you know, I started my first 10 years in hospitals. I have a Bachelor of Science in Nursing, Bachelor of Arts in Psychology. Spent my first 10 years in hospitals, mainly in psychiatry, but also in medical and diabetes units. But in 1996, I finished my MBA in healthcare administration, and then spent the next 20 years in insurance companies in between operations and sales. What happened was at the very end of 2014, I crashed my bicycle while I was out riding. I had an accident and I had surgery, and I went out on leave to take care of that. And while I was out after surgery a couple weeks, I went to my chiropractor's office, and she said, "Why don't you have Denise work out your shoulder, my post-surgical arm?" And she was using CBD in the oil. And I said, "Hey, what is this? It smells funny." And she said, "It's cannabis." And I said, "Well, why are you putting cannabis on me?" And she goes, "It's anti-inflammatory. It's going to help you get back to that pre-surgical arm faster and get rid of some pain and swelling." And I said, "Okay, sign me up and tell me more." And pretty much on the way home, I went to the library and started checking out every book I could on cannabis medicine and researching this. And I discovered I have an endocannabinoid system, and that molecules from the cannabis plant can help bring me back to balance and restore my health in some ways. So I said, this is something I need to dig into 100%. And as I progressed and started to take some CBD myself, internally as well as topically, I started to really heal. And before you know it, I didn't need the Motrin and I didn't need the muscle relaxants after my surgery. And before you know it, after that, I didn't need a bunch of the other medicines that I was taking for depression and sleep and blood pressure and GERD. Over time, I found freedom from all of these medicines. And I said, if I can do this for myself, I'm going to have to do this and help others. So I founded Holistic Caring back in the beginning of 2016. I've been doing this ever since, the last 5+ years of direct patient care. And as I was onboarding more nurses to train them to work with me, I wrote a training manual that became my book, and the book became all of my programs, the Cannabis Health Coach programs for professionals, as well as all of these self-guided healing programs we're going to talk about on the educational side. And I've been having a lot of fun really trying to bring this to the world and get people to understand why this does work and how we can help. I sit on several boards actively. I don't sit at all. I'm the treasurer of the American Cannabis Nurses Association, also the director of health for Los Angeles NORML, the National Organization for the Reform of Marijuana Laws, as well as the California Cannabis Chamber of Commerce. So our objective today, we're going to talk about the why cannabis health coaching needs to exist. And you have to start with the flaws in conventional medicine. And it's not necessarily just flaws, but the shortcomings and the ramifications of all of the ways that we've been doing things. And then to talk about briefly the products and basic dosing with CBD, and the ability to couple that with lifestyle medicine, how to have a beautiful 1-2 punch to really heal the body and bring us back to wellness, as well as to potentially save money on the pharmaceuticals by hopefully reducing them. And then talking about the programs that we offer for healthcare professionals and patients, as well as our affiliate program. So that's kind of our agenda. And then we're going to go through some Q&A. So why bridge the gap? This whole system that we talk about, healthcare in America, it is broken. I don't know how many people realize this, but 1 out of 2 of us has some kind of a chronic condition. And when we think about this, you know, we have to do an honest assessment of our health and how we're supposed to be working and healing and being productive, healthy, happy humans. And when we think about healthcare, don't you think we should have every tool available in the kit to guide patients towards healing? And integrative care, as opposed to conventional care or in lieu of and complementary care, plus cannabinoids, boost health and well-being by blending intuition, science, and nature. I always like to say cannabis is the perfect medicine because it truly is art and science. You take the science as far as what we're learning about the health effects of cannabis and cannabinoids, as you can see in this book on the right. This was published by the National Institutes of Health or the National Academy of Science and Engineering and Medicine back in 2017. And it was an exhaustive literature review of all of the studies that have been done on the previous 20 plus years on cannabis and cannabinoids. And they found conclusive evidence that cannabinoids can be very effective. But the problem is, you know, we still have Schedule 1, where they're also saying that there's no medical benefits. So we have a hypocrisy here in America. So we don't get to the science and the art, except for people like me that are trailblazing pioneers in this industry. And I do this because of the patients. When I think about it, you know, when you think of that 1 out of 2 of us has a chronic condition, you know, if we got 262 million people living with some incidents of chronic pain, PTSD, anxiety, depression, insomnia, mental health issues, autoimmune conditions, cancers, neurological issues, autism, epilepsy, neurodegenerative conditions such as Parkinson's, Alzheimer's, MS, ALS, all of these conditions do really poorly with conventional medicine and the way that we address healthcare in America. We're spending $3.5 trillion in healthcare in this country, and we still rank 42nd in outcomes as far as life expectancy and productivity and the other things that manage our quality of life. And now also in the era of COVID, I think all of you guys recognize that healthcare really is self-care. And how do we practice stronger self-care? And cannabinoids, can they be a tool so that we can get there? My answer is yes. So, and here's the other thing. When we think about opioids, this map shows you that physicians are still prescribing opiates despite the research that we know better now and the warnings that they should not be prescribing opiates. But in 2018, which is the last year that we actually counted this, 1 out of 5 Americans was prescribed an opiate. And it's really a travesty. And if you look at the numbers in the Southeast, those are states without medical cannabis laws. And we know that in states with medical cannabis laws, like the Northeast, California, up in Washington, we have lower incidence of opiate prescribing, as well as overdoses, because in medical cannabis states, we have a 25% reduction where we have access to medical cannabis. And when we think of the opioid epidemic, you know, 80% of the people using heroin in this country started with a prescription pill, the likes of oxycodone, Percocet, Norco, fentanyl, Vicodin. People get those for a procedure like my shoulder surgery or any other kind of procedure. And then there are people that get addicted to them very quickly. In fact, if you've been taking an opioid for 30 days, then the likelihood is that you're going to be on them for 3 years. And it's really, really nuts in this country. But 41 people die every day directly from an opioid overdose. But last night on NBC Nightly News, I saw an update to that the opioid epidemic was decreasing because the doctors stopped writing them. So we had an impact of untreated pain and the productivity issues that have to do with that. But now they're saying that 200 people in America are dying every day because of opiates. It has gone accelerated back up like a hockey stick because of COVID and the mental health issues that this pandemic is causing. So we're still not out of the woods at all. So why isn't cannabis and CBD a true option? You know, I did mention the scheduling. So Schedule 1 means no medical benefits, highly addictive and abusive and dangerous. And we know that's not true because we have all of these medical cannabis programs. We have 37 states now with safe legal access and 17 with adult use or recreational access where you don't even need to go through the qualifying conditions anymore. But we still have these 4 Ds that are in the way, even in the medical cannabis states like California, where I am. So D1 is the disconnect. The medical patients, the providers, and the dispensaries don't have any kind of a connection. There's distrust on the safety, the quality, the efficacy of these medicines. How do I know what is good medicine? How do I know what I can trust? Disorganization. All of these medical cannabis states don't have any true systems for medical patients to approach this. And then dosing. Cannabinoids do really well with people when you have fine tuning and clinical care, maximizing the benefits and minimizing the harms and walking people through this. And so what we've decided to do at Holistic Caring is to really take it on ourselves to bring process to providers so that products can get to patients safely. We're professionalizing the system. So there has to be programs, there has to be process to integrate this into healthcare, to be able to say, how do we put this side by side with the other things that the patients are doing with respect to the pharmaceuticals, with respect to the other treatments, chemotherapy, radiation, surgeries, etc. And then how do we bring the providers in? How do we build an inclusive program so that the providers also have a seat at the table and they feel included? So you have to have a curriculum to train them, first of all, and then you have to have supportive care and mentoring so that they have a running ramp to start to be able to add this to their practice and to understand how to have these conversations with their own patients. And then you have to have products that are vetted. How do we understand what quality medicines are? How do we look at the different criterias? And what is a certificate of analysis? And what does that mean? And how do we do a cost-benefit analysis? And are these medicines really symptom targeted so that we can bring this to patients to comfort and heal their conditions? And then finally, the patients, they need programs. They need personalized care where somebody's going to sit down with them and explain it all to them. That's what I tell people I do all the time, to make this practical. And then they need programs so that they can approach this and understand how to really bridge the gap together with help. And that's what we do. So I always tell people, if you see something, say something, speak up and enlighten others on the potential of cannabis medicine to restore health. That's why we're here today, so that you can help us to overcome the stigma of cannabis and all of the almost 100 years of prohibition where they have lied to us and told us that this plant is dangerous without medical benefits, while having a patent on cannabinoids as neuroprotectants and antioxidants, and really building the system based on recreation and adult use and normalizing cannabis like alcohol. That's not what we need to do. We need to medicalize this, and we need to get patients to really understand that those 4 Ps are something that we can do every day. And this is what we do at Holistic Caring. So we're changing the narrative with education. When people ask me, is this recreational or is this medicinal? It's always both. And it all goes back to the intentionality. How are you planning to use cannabis, and what products do you want to use? And then what is the dosing? So, we can talk about all of your goals, and then what is a lot of times I'll ask people, what is their goals and objectives for using cannabis as a medicine? And then what are the things that they want to achieve in their life? Yesterday, I went and I saw a patient in person, which is wonderful to do again. And, she wanted to be able to take a walk. She lived right on the coast, and she wanted to be able to take a walk again with her walker outside. She's 89 years old. And that is a wonderful goal, to be able to feel strong enough to get back outside. The weather's warmer. I want to be able to take that walk like I used to do. I don't want to hurt. I don't want to feel like I don't have any energy, etc. And so that is my goal, to help her. So now we also have to say, what are the other pharmaceuticals you're on? What are some of the interactions we need to stay cognizant of? And how do we talk to your doctor about maybe weaning down some of those? And then contraindications. Generally, most people can do this just fine with low dosing and working with a clinician to achieve their goals and objectives. But a few people, like with acute psychosis and things like that, should not be using THC. Other than that, we have a pretty good running ramp to be able to help people. Then, of course, in our 37 legal states, we need to say, what kind of access do you have? What kind of paperwork do you need to make sure that you're legally following the path? And then what are the risks versus benefits? When we look at cannabis versus the pharmaceuticals, what are the safety profiles of both of them, the side effects of both of them, the efficacy of both of them, and the costs? Let's really look at this. Then we need to explain how this essentially works in the body, telling them the ECS, or the endocannabinoid system basics, why this works as medicine. We have a series of receptors on our cell membranes that these cannabinoids tag into, and then change the physiology of that cell back to balance. And it's getting people to understand that this is more like a vitamin than a drug, is something that then gives them, oh, okay, I want to do this. Then they have to learn the differences between the cannabinoids, CBD versus THC, terpenes, starting points, titration schedules, dosing ranges, and all of the ways that cannabis can be used into the body, and setting expectations and tracking that, and then making modifications and adjustments. So all of these different ways to take cannabis are available in our modern dispensaries today. And so what we do at Holistic Caring is mix and match these for patients to give them the best efficacy with the lowest dosing out of any of these, to prevent any kind of tolerance. And then you have to continuously modify the treatment plan to make sure that everything is going the way that you want it to, and make adjustments. Because 1 to 10, where are we at on your pain, your anxiety, your focus, your mood, etc. And are we getting more favorable results, or are we having any kind of side effects, and how do we adjust that? So the ways forward are generally just the same way that we do any other kind of clinical pathway in medicine. You start something, you track it, and then you make modifications to that. So dosing basics, I always like to talk about the minimum effective dose. And that is where we have Goldilocks dosing. This whole system, the endocannabinoid system, is getting us back to health in a Goldilocks way. So what is that just right homeostasis or balance in the body at the cellular level? So we want to get potent enough medicines into the body to trigger a response and to reduce symptoms, but not enough to create side effects. That's the whole goal of doing this clinically. And you can see it has a very wide therapeutic window. We can help somebody with 10 milligrams a day, or in the case of the 89-year-old I was with yesterday, 5 milligrams a day to start, 2.5 milligrams of a 3-to-1 CBD to THC oil. And that is going to, slowly morph into whatever it's going to become next, but we're going to see what that starting point brings us. But 500 milligrams a day, now we're talking about maybe cancer dosing, where we might go up to 5 milligrams per kilogram. And that's a whole different conversation. But we have all of them and everything in between. But there's a lot of flexibility as we rotate through these various routes of administration and bring people better days. The beauty of this is that less is more with cannabis. We can approach this in a very strategic way, and it doesn't take a whole lot to nourish the body back to healing. So I always like to talk about a little bit of side effects and safety, just to have people be a little bit more educated. With CBD, generally the first side effect that I'll talk about is dizziness. CBD is a vasorelaxant, which means it opens up the blood vessels so that blood pressure might come down a little bit. And that is giving people a relaxation that they don't normally feel, and they might have a little bit of dizziness as that happens. You can have a little bit of jitteriness or a fatigue, a little bit of fast heart rate if you get a high dose, but generally there's not many side effects with CBD. THC, obviously, you could have some disorientation, and that increases with dosing. 1 or 2 milligrams is underneath that psychoactive threshold. 5 to 10 milligrams, you might start to feel a little intoxication, sedation. As you go up on dosing, THC can be very sedating and tiring, which is why we give it at night to help people sleep. Some people might get a dry mouth and maybe a little bit of short-term memory impairment, which dissipates. And then, we need to clinically sit down and look at the other medications they're on, because there's something called the cytochrome P450 enzymes, where those metabolize drugs as well as the CBD. And sometimes CBD can hog the exit path on the way out of the body. So we tell people to space the drugs and the CBD about an hour or so apart, sometimes more. But think about grapefruit interactions and potentiation. Most of the time, CBD will help the other drugs work better, which is great when we're talking about opiates, because that's how we wean people down. I have a great success pathway to wean people off of opiates in just a few months and find freedom because of how cannabinoids work that way. As far as food, cannabis is lipophilic, and I like to tell people about taking it together with some nutrients, because it boosts it into the bloodstream and you have better effectiveness. And then, just going for just normal folks, 10 to 100 milligrams a day, but acclimate and be patient. So get used to it over a first couple of weeks, side effects dissipate, and then we have a long time to see how to actually dial this in. But cumulative dosing really heals. And of course, all of this is really sculpted with personalizing this and dialing it in for our clients. 1 to 10, where are we starting at, and how do we progress so that we're doing the right thing in the right way. And then how do we talk to your provider? How do you have this conversation with your doctor? And how do we get more doctors to understand that patients want to use this? Cannabinoids affect other pharmaceuticals. They need to learn about this. There are thousands and thousands of studies. This is one of the most studied plants on earth. And it's got more studies in PubMed, our repository of all the scientific data and information, than just about anything else. And every part of health should be openly discussed. There are so many patients that are saying they're not going to tell their doctor because they don't want to be judged. And this is a travesty in healthcare, because we need to all be on the same team. I always talk about the integrative tips that can boost the endocannabinoid system, because this is what really gets us fueled for health. Health is the absence of dis-ease. Dis-ease is caused by inflammation and poor diet. So how do we get an anti-inflammatory diet going? How do we get people to eat more vegetables and low sugar? If we use cannabinoids, we can, because microdoses of THC can make those flavors come alive. And through a period of adjustments where we're making fine tuning to the diet, people can start to gain on that. And that's a program that I take people through as well. But walking, strengthening, stretching, how do we get you to move more? We can use cannabinoids so that we can reduce the pain so that you can start moving. How do we get you opening up your spirit? having that breath, sense of God, whatever that is to you? How do you feel like you're connected and included? And some of this is working on the mental health levels, but really helping people to feel part of the whole and speaking up and setting boundaries. Because when people don't do that, they can get really sick, and they need to be able to assert what they need and feel like they're able to speak up. And then how do you do some healthy, fun things like hikes with a family? That is always one of the things I like to talk about with people on how to really practice stronger self-care in sleep, fitness, and nutrition. And I always like to talk about if you change the way you look at things, the things you look at change. When we think about cannabis and what we've thought about it for the past 100 years, we need to change everything, because it is not something that is dangerous, addictive, and abusive. It is something that is a botanical herb that is going to nourish your system, your endocannabinoid system, back to health so that you can have better days. And that is the conversation changer. So we are hardwired to respond to these cannabis supplements, and they are antioxidant, neuroprotectant, anti-inflammatory, analgesic, antidepressant, anti-anxiety, so many much more. Conventional medicine is not enough. Patients need help, and these medicines are safe. They can be dosed with very flexible options, and this is going to shift healthcare from illness and disease to health and well-being. And then the cannabis industry, as we grow, is going to help solve society's unmet health needs. So with that, I'm going to go into a few dollars and cents. One of the objections is that this is not covered by insurance, and it's not just yet, but there is a way to budget for this. And, you know, unfortunately, a lot of people are saying, you know, it's more than I can bear. I usually tell people, we got a budget about $150 a month to really mix and match these things, to start a good treatment plan, and then to continue that and to make those modifications. But my job at Holistic Caring and all of our nurses and programs is to help people dial this in with the most efficient and effective pathway with our protocols, so that you don't waste time and money, because that is the thing. You know, like if you spend $150, you want that to work for you, and we can help you be much more effective very quickly. When I think about the pharmaceutical approach, there is a medicine that is the first FDA approved CBD, and it's called Epidiolex. It was approved in 2018 and started for sales in 2019. It is for seizures. When we think about how CBD balances out the neurochemistry in the brain, that's how it works. But the FDA approach is $3,000 a month for these families to get this drug for generally kids that are having the refractory seizures, where they've got 300 seizures a week. Just taking CBD might be able to do the same thing. Can we get you a pathway that it might not be quite so expensive? And when we're looking at the traditional pharmaceuticals, let's look at what the cost is of some of those drugs. Keppra and Lamictal and Klonopin and Vimpat, all anti-seizure medicines. And you can see some of them are very expensive and some of them are very cheap. Most of the time, pharmaceuticals have gotten into the generic levels where they're very inexpensive. But if you look at, you know, the cannabis side of this, if that child needs 100 milligrams a day, we might be spending $300 a month. And, you know, what's the cost benefit analysis on that? What are the side effects of these drugs? And how do we give people a better day without that? So I have a dream. I always like to say I have a dream when I think about insurance coverage for cannabinoids, because it really does need to happen one day, where we have coverage on the insurance markets in the different levels of actuarial care, where we have basic coverage for these tinctures, for fully extracted cannabis oils for patients that have serious illness, topicals, and then the endocannabinoid system counselor like me or other nurses that are trained to do this. We need to bring this into traditional healthcare, and we're working every day to see how to do that. And we're doing that because we know that cannabis can help lower our costs. When you think about seniors that are using cannabinoids and replacing pharmaceuticals, Medicare is saving money, and they know it. There are also people that are in younger areas just replacing over-the-counter drugs, opioids, anti-anxieties, and sleep drugs with CBD on their own, and reporting back to other people that are doing surveys of patients using CBD to prove the market. But we don't have the ability to change things like that, even though I'd love to. But this is data showing that we're making the case. So our why at Holistic Caring is to make the clinical case of cannabis and why it needs to happen. So, this is me with one of my favorite patients who I removed from opiates over time, and speaking to the National Association of Health Underwriters on the cost-benefit analysis of cannabis, and telling them that this is something that's here to stay. So at Holistic Caring, we have developed these programs, and the programs are giving us the professionals, or giving professionals the access points that they need to begin learning about cannabis as medicine. So on the healthcare side, I have created two programs. One is the licensed cannabis health coach, and one is the cannabis health coach. And the program is the same. It is a very robust curriculum on all of the history and the science of the endocannabinoid system, all of the different cannabinoids, the terpenes, the pharmacology, all of the different products and dosing guidelines for starting protocols and titration pathways for patients, all of the different conditions that can benefit from this, from cancer to chronic pain to neurodegenerative conditions like Alzheimer's, Parkinson's, MS, epilepsy, autism for kids, as well as inflammatory diseases, metabolic syndrome, and autoimmune conditions, and then mental health and anxiety, depression, PTSD, insomnia, psychosis, how to use cannabinoids for all of those conditions, as well as understanding how to incorporate this into healthcare and coaching and your practice. And the licensing program comes with what I call my business in a box toolkit, where we give the coaches that are healthcare practitioners all of the forms, the assessment forms, and all of the ways to teach a patient about cannabis. So all the patient teaching you could possibly need, and then a care plan to communicate what they should start with based on your assessment and recommendations. And then all of the dosing guides and formularies and ways to understand this and convey this to patients. So everything is there on the healthcare side. And then we have a cannabis industry pro course that takes out the pharmacology and makes it so that those conditions are all in an overview, so that people have foundational knowledge still of how cannabis works as medicine, but not all the deep dive that the healthcare professionals need, but just a way to have these conversations to really help assuage fears and to broaden education for all the people that the industry pros might interact with, because they might be working in dispensaries or in a lab or other product companies, etc. And then I have a CBD wellness coach. Think about, like, especially on the East Coast, you see CBD stores everywhere. So that is a basic understanding of the endocannabinoid system, holistic health and well-being, and how cannabinoids really modulate this system back to health, and how to use CBD for therapeutic purposes. So those are the professional programs. And then on the patient side, these are our self-paced healing programs. And so we have one for cancer, chronic pain, Alzheimer's, Parkinson's, mental health, holistic wellness. The autism and epilepsy is being launched as we speak, hopefully today. That one is going to be live, and then autoimmune will be done in a couple of months. And what these programs entail is a 60+ minute recorded lecture of me speaking through Zoom about each one of these conditions and exploring what's going on with that condition. So in cancer, what is going on in the body with cancer? How do we diagnose cancer? How do we stage cancer? What are the different types of cancer? Then how do you treat cancers? And what is the difference and how do we stagger out surgery, chemotherapy, radiation, immunotherapy, targeted therapies, and that sort of thing. And then what are the treatment side effects and ramifications and shortcomings? And then what about cannabis? How might cannabis work for cancer? And what is the preclinical data along with all of the research that talks about what we're finding on how cannabis works for cancer? And then maybe we can use this for anti-cancer properties, but that's a preclinical thing. And preclinical means that the researchers are still in the mice and the rodents and the cell cultures. But there are people that are living with cancer who are using cannabinoids, who are shrinking tumors. And that is what we're seeing in observational data. And a lot of my patients that are doing really, really well on cannabinoids concurrently with the other treatments that they're doing. And then what about the palliative side? So we're able to get people to eat again. And to show up at the dinner table and to not be in pain and to not be anxious and to be able to sleep. That is really what we're trying to do to eliminate nausea and vomiting and the other things so that we're giving people a higher quality of life. And then we teach them exactly all about the different cannabinoids and then dosing for each route of administration. So for cannabis and cancer, how do we use inhalation? How do we use edibles? How do we use tinctures and all the various formulations, topicals, transdermal patches, fully extracted cannabis oils if they want high dosing? And how do you use high dosing together with chemotherapy and immunotherapy? All of this is spelled out in our programs. And then we go into a deeper dive on the integrative health side and how to incorporate holistic wellness in addition to the cannabinoids to truly heal. So that is our program. And there's one for each one of these diagnoses: Alzheimer's disease, Parkinson's disease, MS, autoimmune, epilepsy, mental health, etc. The clients then get the PDF of all the slides and all the references and the research that built that presentation, along with a digital guidebook that gives them step-by-step understanding of cannabis healthcare and how to incorporate best practices and protocols into their treatment plan. And then we give them a forum so that they can connect with their peers that are also going through cannabis and cancer or whatever healing journey they might have. So this is also in an app so that somebody can open this up in their phone or their iPad or whatever and share it with their family and watch it over and over again so they can really take this message home. So we are also looking to partner with our dispensary partners and CBD stores and that sort of thing. Holistic Caring will build your medical door, right? We know the adult use recreational door is wide open, but we need to build a medical door so those patients are supported and guided. So for anybody that is in the industry, we will help you expand sales to medical patients that need more hand-holding and support. That's what we do at Holistic Caring, so we've got your back. We need to train your employees in the dispensaries and with the industry and the CBD certification. And then also you can have patients call us and we will do our telehealth across the whole country and even globally. I have patients in all kinds of countries where we can optimize their care regardless of where they are, dialing them back in with a better plan that's going to work for them. And then there are affiliate opportunities for people to help us spread the news because, you know, I'm not a really big self-promotional person. I need people to help me share these programs. So we created a robust affiliate program where we have turnkey programs and marketing that you can share with your audience. Maybe you do like social media and you can put this out into social shares, email messages, banner ads on your website. People click on that and then they will be able to come through to our programs. They purchase something. There's a dashboard that gives you your stats of how many clicks, how many purchases, and then commissions. And then we write monthly checks to our affiliates. And I've created this on an insurance compensation package where, you know, 1 to 100 is 10%, 101, 20%, and 501, 30%. And that's retro to 1. So every time you hit a new tier, I write you a big check and we have some fun together. So please explore our library in the programs. Our website is very robust and being sculpted more and more each day by Alp and Brian and all of my beautiful team. And Tasha Jackson, I call her the lovely Tasha Jackson, has helped me put together all of these programs. So please visit the website and hit contact us. Let us know how we can help you and how you might like to engage with us, because we have really created this whole ecosystem of care. So the education, the service, the products, the vetting, our CBD marketplace is now called The Shop. So, please look and see how we can work together and help us to bridge this gap between conventional and cannabis healthcare. Thank you for your time today. And now I have some time for Q&A, and we can go through everything else that people might have questions about. So with that, let me go back to my Zoom and see if anybody would like to come off of mute and have a question. Okay, does dry mouth with THC dissipate over time? Cheryl, generally, yes, but sometimes it doesn't. So sometimes you have to play with spacing and timing. If THC is causing a lot of dry mouth, sometimes we could use that more at night so you can sleep through it and still have the benefits of THC the next day. So it's all going to depend. A lot of people have a real sensitivity to that, but generally, it does wear off over time, but sometimes we need to space things out. Maybe try THCA, which is going to be less drying. All of these different cannabinoids have a little bit of a different effect, and some people don't get that at all, and some people get it a lot. So a lot of times, this goes back to my answer, is that we have to personalize this, and we have to dial it in for each person. And use sometimes gums and lozenges and that sort of thing to assuage some of that as well. So other questions? For those recovering from addiction to alcohol and other narcotics, how would CBD affect these people? Would it be something for them to be concerned about? Well, actually, it goes the other way. There are studies where CBD is being studied as having very potent anti-addictive properties. When rats are given CBD, they're not hitting the button to get the morphine because they're not as interested in the morphine. They're interested in other things. And cannabinoids have a beautiful ability to bring the body back to balance. And if you are doing some good holistic things to come out of the addictive mindset, coupling that with CBD is a great way to go forward, because the brain is going to be having adjustments in the amygdala, in the hippocampus, back to health and balance, and addiction can then be reversed. Same thing with opioids. When we're, and I see Heather was able to get off, her brother was able to get off opioids using CBD for pain. So when we're working with addiction and pain, if we're going back to the opiates, and 200 people dying in America nowadays, now we are able to understand that when you're using CBD and THC a little bit for addiction and for opiate withdrawal, we can decrease some of the nausea and vomiting and spasms and stomach issues when people stop using opiates. We can decrease the anxiety and the sweats and the insomnia with cannabinoids. We're using THC. Generally, a 1-to-1 ratio is the best way to wean people off of the opiates. And so we've got pain management with the cannabinoids and the anti-addictive property of CBD, as well as walking that pathway of freedom. So it's a multifaceted path. You need to be having mind body working together, but we can absolutely erode some of the addiction as well as the opiate problem in America with cannabinoids. Okay, let's see what else here. Cyrus, same question. Is it a slippery slope? Could it be open the door to someone in recovery to relapse and go back to abuse THC? Well, this goes back to the purpose and the intention. So why is somebody using things in an addictive way? That's always the first question, because you can, and John Malanka, he's a good friend of mine from United Patients Group, and he has a phrase: you can have a glass of wine or you can have 2 bottles of wine. How do we work with that person's mindset so that they can have the glass of wine? THC is not a problem in and of itself. It's how it's approached. And especially some of these youth, 20-year-olds that are, hitting the bond and having high THC all day long, what's really the problem there? We need to talk about the root cause of that behavior. It's not the THC. But, can it be a crutch for somebody to stay in an addictive pathway? Absolutely. And they might get sick from that. But we need to work, again, mind, body, and spirit, and try and get them to understand that more CBD, less THC is going to be good. Is dosage info and or product suggestions available in the patient modules? Yes. In each one of those patient programs, with respect to however we're working in that diagnostic code. So neurodegenerative is going to be very different than cancer, which is going to be different than chronic pain, which is going to be different than autism and epilepsy and mental health. So each one of them have dosing guidelines for each route of administration based on what they're going to need. And remember, this is starting protocols. Where people end up is going to be very different. But our job is to give them, the training wheels on how to use this as cannabinoids in medicine, and in a complementary way with everything else that they're doing, being safe and secure.
Thank you for that, Elisabeth. Thank you all for joining us.
All right. Mahalo.
Mahalo.
Thank you.
Have a
Thank
nice
you.
day.